We're just so glad that Governor DeWine and First Lady DeWine have chosen to take some time to visit us here at Southern State Community College. I remind people all the time, this is your state community college, and we mean that. We're just so glad that you've taken some time to see our new Health Science Center, to talk to some of our nursing students, and welcome to Southern State and to Hillsboro, Ohio.
President, thank you very much. Appreciate it.
Thank you.
I think I saw Senator Peterson somewhere here. There he is. Bob, why don't you come on up here? You know, we've worked very well with the General Assembly, and one of the things that I think we all have a passion for are our two-year colleges. Our community colleges are doing really a phenomenal job, and it's a inexpensive way, affordable way for students to get the education that they need and a pathway right into a career. We just had the opportunity to talk with some nursing students and you know, talked about listen to them in regard to what their future will be, and you know, I think they're all very, very excited. And we had the opportunity to hold the baby back there, so that was
certainly the opportunities for students to grow in their life and to have a career, not just a job, and especially with what's happening with this wing. You know, certainly nurses are in great demand. My mother was a nurse for 30-some years and didn't get her start at Southern State, but a lot of people do. And proud to represent this area and proud of this university and the graduates that cover this program. Excited to see more. Great to be with you.
so we're happy to respond to any questions.
Well, you know, speaking of that, the nursing shortage during the pandemic, so how glad are you to see a place like this is turning them out?
Well, very glad to see the nurses and future nurses who are here. I think we know that nurses are always going to have a job, and that's one of the things that I think every student who's going through here knows. If they're a nursing student, when they walk out the door, they're going to be able to get a job. And you know, we have certainly seen the need for more nurses during COVID, and we know, frankly, how tough it's been on many of the nurses and some of the things that they've had to go through. So it's you know, it's exciting to see young people and sometimes not so young who, you know, are getting their degree and will be able to be nurses.
Will all that $149,000 go toward security and stuff, or will some of that be able to be used elsewhere?
I'm going to let the president take that one.
That will all be security equipment. Yes, thank you.
All right, so let's talk a little bit about, off subject a little bit about redistricting. Where are we with the maps right now? I know a deadline's looming.
So there's maps that are being exchanged and circulated. I think the one thing that sometimes is missed in this discussion is that the Constitution now has a lot of different things that have to be met and hit. And sometimes those are almost in contradiction to one another. The compactness of a district sometimes has to give way to not breaking up a city or breaking up a community, what the Constitution calls a community of interest. So these are the challenges that it faces, that we face. And I don't know, Bob, if you want to make a comment about that at all, but our goal is to have a constitutional apportionment map. And that's really the goal, is to make it constitutional. And you know, there's just a lot of metrics that have to be met, and sometimes they almost are in contradiction to one another.
Is there, and I might be wrong, but is there public comment coming up?
Yeah, there has to be public comment. There should be public comment, and you know, this is a process that the public at the beginning had the opportunity to make comments in public hearings. Now specific maps are going to be put out there. There may be a map that is adopted in the next few days. Then there will be an opportunity again for public comment on that particular map.
And then the deadline just move, right? Whenever you get
Look,
a new.
the challenge has been that the census was over 100 days late. And everyone just assumed that the census would operate as it always has operated, which is kind of on schedule. And the Constitution was written, this provision of the Constitution, based upon that assumption. It turned out the assumption was not right. And so everyone is now scrambling. I think ultimately the most important thing is what do we end up with? And so we're going through, drawing lines for the state legislature. So Ohio loses a member of Congress. So that means that obviously the lines have to be rather dramatically redrawn. And the question is, where is that district coming from?
All right, so lastly, let's talk about boosters a little bit. Do you foresee that opening up on September 20th, or what's your team telling you?
Well, we're waiting just like everybody else in the country is waiting. And it looks like, the White House may have got a little out front of the FDA. We're going to ultimately have to see, what they come up with. And we will follow the guidance that is put out in regard to boosters. I think it's a question of, who needs the booster and what that priority list is. But we are getting ready. We've been working on this. We will want to be able to continue to get people vaccinated. We are vaccinating in the state now on average about 10,000 new people every single day. These are people who in the past have not gotten the vaccine for whatever reason, who now, because the variant is so dangerous, are now getting vaccinated. So we want to be able to make sure those individuals, whether it's 10,000 or 20 or whatever it is, those individuals can still get vaccinated. At the same time, we want to make sure that people who need a booster are, in fact, able to get a booster.
And I know you have a team working on this, but is the priority unvaccinated? I mean, are the priorities equal, boosters and unvaccinated?
We think we can do two things at once. Again, we're waiting for guidance from the federal government. We don't have that guidance yet. We can't really move until we do have that guidance, and so we're waiting. But the goal, of course, is to be able always to have that first shot for someone. We don't want anyone in the state ever to be in a situation where they want to get, they've decided now after waiting for months and months, and they've now made the decision, I want to get it. We want them to be able to get it right away.
Right.
Very, very important. And look, this variant, the Delta variant, is very dangerous. Here in Highland County, it's one of the top counties in the state as far as the spread. So it's something that's very relevant right here, but frankly, it's relevant across the state because every county is at a high level today.
That's true. Everybody's at that red level still of transmission rate. So we'll see on September 17th what the FDA says, what the Biden administration says. In Ohio, it's available for healthcare workers, right? Frontliners?
It's available on a very limited basis to people who have certain medical conditions at this point.
Okay. So I heard somewhere that doctors were getting it, so maybe I'm wrong on that.
I'm not aware of that.
Okay. Anything else you can think that is top of mind when it comes to COVID?
Well, I think yesterday our children's hospitals had a press conference. It's very unusual. You had every children's hospital in the state represented on one press conference. And they called the press conference to really explain the situation that we are in today, where we have our children's hospitals that are filling up not just with COVID patients, but also young people who have other respiratory problems that normally we don't see this time of year. So as I talk to children's hospitals, they have a real concern. And their message, I think, yesterday was very, very clear. If your child is old enough to be vaccinated, they need to be vaccinated. If they're not old enough to be vaccinated, they need to be wearing a mask in school. And so, they were very strong yesterday in urging every school, public and private in the state, to put a masking order on, at least for the immediate future, until we get through this very, very difficult time. So they're real summation of the Children's Hospital's message was, if you want your kids in school, get them vaccinated. If they can't be vaccinated, you know, have them wear a mask. And that's how we keep our kids in school.
At what point do you kind of say, schools, you gotta put on a mask?
Well, it's a little different than it's been. We now have a law that's been passed by the General Assembly, which says that if I put a mask order on, the state health department put a mask order on, or any health order, that the General Assembly can go into session, and by a mere vote of both the House and the Senate, they can strip that health order out. So I'm very cognizant of that. That's where we are. What we've seen in the last week is, I think, some progress. We now have about 40% of the students who attend public schools in the state of Ohio are going to a school where there's a mask mandate K through 12. That is going to be very, very helpful. And our message for the other schools is, if you want to be able to keep your kids in school, which is what we want to do, we don't want to have schools close. If we want to keep our kids in school, the best way to do it is for everyone to wear a mask.
Anything else?
Thanks, everybody. President, thank you.
Thank you so much. Good to see
Good to see you,
you.
Bob. Good to see you.
Thank you so much. Good to see you
Thank you very
again.
much.